Cool. Okay, good morning, everyone. We're going to get started here. I call the special meeting of the Board of Supervisors on Wednesday, June 24th, 2026 to order. Can we please have the Pledge of Allegiance led by Supervisor Curro?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have a roll call, please.
Supervisor Zanger?
Here.
Supervisor Velasquez is absent. Supervisor Kozmicki?
Here.
Supervisor Sotelo?
Present.
Supervisor Curro?
Here.
Thank you.
Thank you. Is there a motion to acknowledge the certificate of posting?
Second.
All in favor?
Aye.
All right, moving on to the regular agenda, 1A. It's our CEO has presentations for us.
Good members, board members, members of the community, department heads. I'm Esperanza Gore Warren. I'm the CEO, and today I'm pleased to announce a presentation for the upcoming budget, the 2026-2027 interim budget. I have a series of presentations per your request. Last meeting, you made several requests for presentation from the different departments. And so I want to acknowledge all those presentations. We'll have in the auditors making a presentation about the OPEB, HSA and behavioral health about impacts from the HR1 as requested. Public Works with Measure G and SB1. Public Works with Parks presentation, the funding that we have available. And finally, the CEO, after all those presentations about the interim budget that we have available for you. But before we start the presentation, I want to address an issue that was brought to me this week by the Sheriff's Department, in which he has acknowledged having an emergency. That I want to introduce his emergency first before we move forward for the projects. And I would ask the sheriff to come to the podium and maybe to let us know about what is happening at his department that could be an impact to our budget. So with that, Sheriff Taylor.
Thank you, CEO. Thank you, members of the board, Mr. Chair, members of the board, for allowing me to speak for a moment. I'll try to be brief, but you know that rarely happens with me. So an issue that I brought to the CEO, and I've spoken individually with some of you about, is that on Friday, it was brought to my attention that we have 3 more deputy sheriffs that are in the process of leaving our office. That's terrifying to me because we're already at minimums. And so it's putting us in the position of really not being able to police the community appropriately. So when we take in our mandates that we have to cover, I have to cover the courts. We have a correctional facility we have to cover. We have coroner duties that are mandated by the Constitution that I have to cover. I've already pulled the dedicated deputy from San Juan Bautista. Now I'm having to pull everybody out of our investigations bureau to cover patrol. So this is putting us on a patrol level of minimum staffing, near minimum staffing for us to be able to cover the county. And my fear is that we're going backwards so quickly that it's like a house of cards at this point. If I lose any more people, we're not going to be able to police the community correctly. And I believe it was Tehama County, I'm not exactly sure, but it got so dire there that they had to cancel daytime patrol. And that's not that far away for our office to not be able to patrol this community during the day anymore. So I just want to go over a couple quick things that since we entered into our budget crisis within the last year, that we've all been working together to come to a balanced budget and cut positions. Some were cut in my office too, not deputies, civilian staff was cut in my office. But since we started that process, I've lost 7 sworn positions in our office, have left to either retirement or to other agencies in this area of California and 1 to Texas. During that time, we've only been able to add 1 deputy. So that's a net loss of 6. I have 3 more in the process of leaving, and I have 2 more on extended leave pending termination. So I'm very quickly going to be down 11 positions in an office where we're going to be down to potentially 1 sergeant, 1 deputy per shift, which is dangerous. So then we'd have to cancel daytime patrol. I understand the position that the county is in. I've been working really closely with the CEO's office and with council. I know I'm not in a position to ask you for anything as far as more funding, but I also appreciate Supervisor Kosmicki and the things that you've been trying to do or ideas that you've had to try to help us with recruitment and retention. So I'm faced with trying to figure out how to stop the bleeding at this point. I have all these open positions that we can't fill, and I promise this community and I promise my staff that we will not bring in substandard candidates to this office. And we're getting applications and we're putting people in the backgrounds, but they're not the kind of people that you want to wear a badge and a gun in your community. So we're not hiring them, which is putting us at a deficit. I recently met with the sheriff of San Mateo County that pays really well, has a brand new building, has great equipment, has great morale. They're down 100 deputies. And that's just one place close to here that has much better compensation packages than we have. And they're down 100. So we're all fighting over the same small pool of candidates. So what can we do to attract people? But what my main focus is right now is how can I stop more from leaving and make it more attractive to be here? So my proposal to the CEO and to this board today is that I'm willing to freeze positions in my office, take the funding that's already been allocated to me. What I'm asking you to do is consider redirecting the funding for 6 of my, which will be 11 open positions. Freeze the funding of 6, which will give me room in my budget to reallocate that to cover the medical costs of the people that work in my office. That would be an incredible, it would be a big difference for them to not have to pay that medical contribution. It's not ideal. I don't like to, that's just going to keep us kind of stunted in growth in the office, which we still haven't got back to our 2010 numbers in our office, and our community's grown a little bit since then. So going backwards is not what I want to do, but I just don't feel comfortable having all these open positions that we can't fill, and then we're just going backward and we're not able to fill it fast enough. So that's a proposal I have, is that I would freeze these positions, which would give me about $900,000. The calculations that Jacqueline in our office did is that to cover uniformed personnel in the sheriff's office, both in the jail and in operations, because we've also had ongoing issues with people leaving the jail. Half the jail is still not open because we can't staff it appropriately. So I'm willing to freeze positions in operations to help cover the problems in corrections. As many of you know, I oversee 5 budgets. So the operations budget would help to sustain the correction side. So my idea is to take this funding that I already have, reallocate it from positions into a benefits package, which would hopefully keep some of these younger deputy sheriffs in our office and make a difference in what they can take home to pay their rent and pay their bills and start their families. And I wouldn't be asking for any more contribution from the general fund. We would just be not getting to the place that we need to be, hopefully soon in the future, with staffing. And I would actually be freezing 1 extra position to give a little bit of wiggle room for any incentives that are outside of this that may be considered. So it'd be about $788,000 to reallocate to a benefits package, and then that would leave us $120,000 or whatever to look into other benefits that we'd be looking about. So I'm open to any questions. Clearly, I appreciate you giving me the time to speak with this idea. I'm just trying to stop the bleeding in our office at this point, and I appreciate all four of you and everything that you've done for us and everything that you've considered. And I wholeheartedly mean that for all four of you. Have been great partners in trying to help us figure this out. So thank you.
Thank you. We'll bring it back to the board for questions, comments. Supervisor
Mr.
Kosmicki.
Chair, yeah, thank you, Sheriff. I mean, these times do call for really bold, thoughtful ideas. And I just want to truly thank you for what you're presenting and what you're offering. It makes a lot of sense. I do want to emphasize again, this is a crisis in this department. Yes, we have, challenges throughout the county, but in this particular time that we're in, we have a real crisis in our sheriff's office with patrol staffing. And this is the most essential public service that we absolutely must maintain at an adequate level. And we're at a point where, yes, we've had some shortages in the past. We've had financial constraints that we've juggled. But we're at a point where we absolutely have to make this our top priority in this budget. And we really do have to focus in on, while we're, doing our best to support our entire workforce, we really have to focus in on making sure that we can address this challenge in the right way and do it boldly. And so I'm going to support what you're saying. I thank you for it. Obviously, we also, I think the board at the last meeting supported these other ideas of essentially putting in a hiring bonus program, or at least looking at it and bringing back the numbers. Hiring bonus program spread over a number of years. I think we've talked about 5. The incentive bonuses of 10% of base pay for field and patrol personnel. The policy to allow new recruits to transfer over years of service for longevity benefits. And then I just, I know that the CAO or CEO might talk more, but there's been some other ideas thrown out there. I want to thank the DSA representative. I did speak with the DSA just about, after I, essentially put this out there as to get this conversation going. And the idea also came out about perhaps putting in a nighttime differential program as well. So if you're working the nighttime shift, you get a pay bump at night, because that's been an issue as well. So I'd love to hear more from the CEO about just the numbers and everything, but I'm going to support your program. I'm going to support, obviously, these incentive policies that I've proposed. But I just want to emphasize to the community that, and the board here, that this is a real crisis and it's our job to address it. We've got to be bold, and we really do have to focus on making sure that this is the top priority right now. And that's pretty much for now. That's all I have to say. Thank you.
Any other comments, questions? Supervisor Rosatello.
Sheriff, thank you so much for bringing this to our attention. And it is Tehama County. It's also Merced County. It's also LA. It's also all of the rural counties have had mass exodus. It's very shocking what is happening and the aftermath of our country, and how law enforcement, unfortunately, and larger counties have had the big impact, and now they're taking from the small counties. It's just a matter of fact. It's talked about at CSAC and NACO on a regular basis. I like the creativity of your ideas. My concerns are because DSA is more than just your department, how are we going to be able to differentiate that? Is this a ability that you have to actually change job descriptions because it's at a job description level, not just a DSA level? I'm not sure what the legality is in this, but I do recognize it is a massive crisis, and it's a crisis that all counties are facing right now. But at the same time, I've spoken to several individuals between last night and this morning, and the crisis is bigger than we even recognize. We have people losing their homeowners insurance, and what they have been told from the providers is that your safety
in your county is so bad that we won't insure you. And when they ask, what does that mean? They said, your sheriff's deputies, your fire, and your ambulance response time. So I don't know how we're going to, this is one piece of the bigger issue, because if residents are losing their insurance and then they end up having to lose either their homes or selling their homes, we are going to turn into a ghost town. So how do we address this as best as we can and realize it is the residents that are hurting because of this crisis? We've talked about response time in the South Bay or the South County and how difficult that is. So I think we need to get more creative. I think we have to collaborate, of course, more with the city on fire and what the needs are, and AMR, that contract, and being able to get more immediate service. I support where you're going with this, but also recognize that the problem's bigger than just what you're facing right now. And I want all of the staff to know, I know each of you are facing issues in your departments, and the cuts are real. We have to come up with strategies of how we're going to increase revenue. Where is our revenue base? If that means that we have to bring back conversations about commercial development on 101, we have to have conversations that bring revenue in so that our community is safe and that the people that are protecting us are also safe. My understanding is it's between $25,000 to $50,000 difference when these deputies leave and go to cities like Morgan Hill or to the Bay Area. That you can come down in your rank. You can be I believe a sergeant here, take a position in another county as an entry-level officer and make $20,000 to $50,000 more. So I see it, I hear it, I've talked to people, I support where you're going, but I think we need to also recognize that the problem is gonna only get bigger as we move forward, and our property values are going to decline. Our revenue from our property taxes will be going down. So to me, this is a crisis as a county and a community, and we need to come together. Stop bickering over little stuff. We have to get focused on the big picture problems and come up with revenue that will actually bring benefit not only to our county employees, but to all of our residents to make sure that they're safe. So I support where you're going, but I think we need to continue this conversation with the budget and understand cuts are gonna happen, but where are those cuts gonna come from and how are we going to survive the services that we're giving up?
And thank you, Sue, to acknowledge your comments, because I think I'm picking up what you're putting down a little bit here. So it's a blessing and a curse that we're so small here. We all care about each other. Some of the hardest parts of your job, and I think mine, is separating our personal relationships from the business aspect of what we've been elected to do. I want the best for I don't want any of my other department heads or electeds to feel any pain. I don't want anybody to lose their positions. As a person, I love everybody. I want us all to get along and take care of each other. When I parse that out as the elected sheriff of this county, my priority has to be the safety of this community when it comes to the boots on the ground, deputy sheriffs in the street, and my constitutional duty of staffing the courthouse and our correctional facility. So it's a strange place to be because it doesn't feel good. Which is why instead of coming to you and doing some saber rattling and threatening to cancel patrols and saying, give me more money and take from someone else, I tried to think of a way that I could just take from what I already have and reallocate what's already in my office. We will feel the pain on that, but hopefully we'll still be able to police this community, and I won't be taking from any other departments right now.
Right. And
I
I think from our last budget conversation, that's really in a single department exactly what I'm looking at as a big picture issue. We need to have the state understand that they cannot fund individual projects or individual programs. Instead, we need that full funding coming to our county and let our county decide where the needs of our people are so that we are as efficient with taxpayer dollars as possible. So what you're doing in a micro department, in a department that is huge for our county, but in a department level, we have to be looking at that county-wide, and we have to have every department understanding that we may not be able to do all of the things that we have done in the past. You were here, I believe you were here when we went through the 2012 crisis countywide, and every single department was strapped down to bare bones. It's after going through all the budget stuff, it's that level that I'm starting to feel that we're getting back to. So I agree with you. We've gone completely backwards from where we were in 2010. And 2012, we, hit our bottom. And I'm nervous that we're going to be hitting the bottom again. So we need to be creative about, and I love the creativity, we need to be creative with departments about what can they do and what can we do together. And if that means cuts, I said it last time we went through the budget cycle, I will take a pay cut to help show that everyone has to be hit on this. It's that important to make sure that we retain our sheriff's deputies, but also all levels of safety and essential services in our county. So thank you. I appreciate your creativity.
Thank you. Mr. Teller, did you?
Thank you. I don't have a whole lot more to add. I mean, I'm supportive of this. I really appreciate you bringing this to our attention, bringing the challenge, but also bringing a solution. I look at this as kind of a short-term solution. I'm hopeful that Measure D is going to bring in some additional funding. We can then unfreeze positions, hopefully get back to staffing levels. So I really appreciate kind of this short-term solution, the freeze of some positions, not all. I mean, we're kind of freezing about half of them, right? So, yeah, thank you. I'm supportive of it, and I hope that this stops the bleeding.
Thank you.
Yeah, thank you for bringing this forward. I do want to say, so in this proposal, we would basically freeze some of them, and then there's ones that are remaining. If they are filled, I would hope that at that point you'd come back and we'd have a new discussion at that point as to what to do if we fill those remaining ones. Is that correct? Is that the
Yeah, I
plan?
appreciate that. And I appreciate you, when we spoke, you spoke about that. It's important to you that when we get to these, God willing, that we get to the point where we're full on the positions that aren't frozen, that I would come back to the board and we can make a case-by-case decision at that point with different numbers and know exactly what we're getting into, and we're going to start adding these positions back. But overarching theme, we can hold the line where we are right now today. I can't lose anybody else. If I lose anybody else, it's going to get really bad.
Okay. Well,
When you're done, I have.
sure. Yeah. Well, I just say I do support the proposal. I think it's a clever way of addressing the situation of just shifting the money around within your office. Supervisor Kosmicki?
Yeah, I just wanted to piggyback. You mentioned that if you hopefully do fill the vacancies that we're leaving, that I think we should put it into the record that it would automatically trigger a reconsideration of those positions once you fill those positions. So they would just automatically come to the board as opposed to, having to try to schedule things and whatever might get in the way. I think we just automatically have that conversation. And then can we clarify, and maybe this is more of a CEO thing, the dollar amount that we're talking about as far as when you say medical, because this is a very substantial direction that we're going in. So can we, and maybe you were going to do that, and maybe that's a good segue to where you were going with
Yes.
numbers, but I just wanted to make sure that we do get that out there.
Yes, actually, the sheriff and I had this conversation so we run some numbers, and I do appreciate very much HR department and my staff for helping me, like, staying late last night so that we can come up with numbers today. Based on the conversation that I have with the sheriff is the potential temporary savings. We're gonna call it temporary savings because this is not a definite way to go in the future. For insurance purposes, to pay for the insurance portion for the longevity as a retention and for night shift and bonuses to just to retain the individuals that we have right now. It will be fully covered with those 5 positions and the 6 positions that he discussed with you. And it will leave a little bit of room for the upcoming deputies that get hired to be able to pay similar benefits to those individuals to attract them to come to
Right,
work to the
but
county.
it was that $900,000 plus
Somewhere at the
number.
$950,000
Right,
more or
but
less.
the medical insurance in particular, do we have a number as far
Yes,
as
I have
per individual?
about $320,000
How
more or
much?
less. $320,000 will be the cost.
And per individual, do we have, or?
It's about $13,000 per individual on a biweekly basis. So what we're gonna try to do, and I wanna make sure that we have a full understanding of how this is gonna work. This plan will be contained into one department because some of the elements in this department are tied to other bargaining unions. So this plan has to be a set-aside letter only addressing the issues with the sheriff's department on a basis of a crisis in this situation. And I'm saying this because you're gonna see the numbers in a few minutes about where we are so far in the budget. And I wanna make sure that we all understand this is projected budget. We will not know the results of the budget until the books closes by August, more or less. And so I want to be very careful about making long-term commitments. So I appreciate very much the sheriff for coming with this idea, creative idea, on a temporary basis, so that when we had the final budget, the closure of the books, that we will be able to address the issue in a greater manner for the future as well. So I think we can make those recommendations once that we complete the budget. I will get direction from you as a board members to let me know which way we'll go. But I can tell you right now, based on the numbers that we run between the human resources and myself last night, those are doable numbers with a little bit of room in case that he hires, instead of hiring 5 people, he's gonna hire 6 people, so they still have some room available. We do have a balanced budget, and you're gonna hear this comments. Last time I came, we were upside down a little bit more than $500,000. But this time we have a balanced budget. How did that happen? I wanna thank the departments that came together to meet with us and to make some additional sacrifices in their departments so that we can come up with a balanced projected budget. So this is not gonna be an impact to the projected budget or the reserves. My concern right now is the level of reserves that we had. They have been impacted with several issues throughout the year that we had to come back to the budget, to the reserves, to touch the reserves. And so we a little bit upside down, and I call it a little bit upside down. It's not really that big because I don't have $1 million in my pocket to say a little bit, but we are in a much better shape than we were last year. Last year, it was a huge sacrifice from many departments to do cuts and layoffs in their own departments. So I acknowledge now that all those sacrifices is bringing us now the benefit to be able to have a balanced budget. So we're gonna go through that a little bit later. I would like to first allow the departments to make the presentations that you request before we finalize the conversation with the budget, and then I will bring back the sheriff's proposal so that you can provide directions regarding the proposals, because I need to have an approval from you to be able to move forward. So with that, I would like to invite the auditor for his presentation. Let me see.
Hold on
if I
one
can-
second, please.
Yes.
We have a question.
Yes.
Yeah, I just want to be clear on numbers. So the sheriff mentioned 788 for medical, and then you just said something about 300. And so I want to be clear what
Yes.
we're talking about here.
So we're talking about the current individuals that we have right now. If he would need additional individuals, then a number increase, and that's what he has, about $150,000 room for additional individuals that get hired. Those are the numbers that were run.
I just
by
want to
the
make sure we're
department.
talking about the same thing here.
Yes.
So I think what we're talking, so for on the operation side of the street, so the deputies you see in the patrol cars is like just north of $300,000, including the correctional staff, which we feel is appropriate. That adds, it takes it up to 788.
Okay.
So with the savings of 900, it's leaving us room
But I just want to be clear.
for the incentives.
But you're talking corrections and deputies, all of your sworn officers
Yeah.
is who you're including in this.
Yeah, all the
emergency-
uniformed staff.
Okay, all right, just wanted to be clear. Okay, so we're looking at that 788 number, not a 300 number.
Yeah, 300
Okay.
for the operation side.
Gotcha.
For like the crisis that we're talking about, that's why I want to present some options to the CEO of like, we just did deputy sheriffs in the patrol car. That's how people can think about it. Just north of 300. If we add in our correctional staff, which is appropriate because we have had an ongoing similar crisis there. The fire right now is in patrol. We're stabilized to an extent in corrections, but I was willing to freeze more positions to make sure that our uniform staff, so we don't have to come right back and tell you now we have a mass exodus from the corrections and now we can't run the jail. So
Okay, okay, thank you. I just wanted that clarification. Thank you very much.
Supervisor Curl?
I was having the same questions because you stated 900,000 and the CEO said 950,000.
So it's a round number. So we actually came up with a little bit higher number than he has. And our HR department is going through the system to identify those numbers. So we're going to bring those numbers when we talk about the budget. We're going to be those numbers per group, whether it's the sheriff's office deputies or the correctionals. We'll have the numbers right there. So for now, if you give us a little break so that we can
no
start the presentations, and then we'll come back with that discussion. All right. Thank you. This is yours? Yes, so they're gonna set up the presentation.
Good morning, Chair and Board of Supervisors. Joe Paul Gonzalez, Auditor Controller. After that bit of news, this will hopefully bring down your blood sugar levels to, so you can, be able to deal with this very difficult issue that you have. So, as you requested, the board had asked that there be a presentation on OPEB. The OPEB valuation that this presentation is based on, as you could see, is June 30th, 2024. That's an old valuation. We are expecting the new June 30th, 2026 valuation sometime in mid-July. So I'm hoping that after we receive it, we can, do a follow-up presentation with the most current numbers from the OPEB actuary.
Yeah.
Joe Paul, really quickly, are those numbers every 2 years then for the actuarial?
Yeah, that's what I was going to explain in the
Okay, sorry.
in the presentation.
Okay.
Okay, so as you know, this OPEB, other than pension obligations, it began in 1993 when the county decided, hey, we're going to use CalPERS for the purpose of providing health care to employees. And so because CalPERS requires all of its participants to, agency participants, to be part of the PEMCA, which is the Public Employees Medical and Hospital Care Act, which that act requires that that over 20 years, whatever the contribution that the county pays on behalf of employees, that contribution must be made to retirees. And so in 1993, the maximum contribution was $1 a month. So kind of key features of the PEMCA is that, this can only be for, government agencies, schools, counties, cities. The one key feature is the minimum employer contribution. So that we call it the PEMCA minimum. But this year, the PEMCA minimum is $162. Next year, it's going to be $167. So as I mentioned, when you join the PEMCA, the county covers retirees with health care until they expire, or until their qualified dependents expire. Another key feature, which is an important feature to be able to control costs, is that the PEMCA allows for vesting options that each agency can, would allow, and in order to qualify for retiree health care. And this, in this county, the vesting requirements are that they have 5 years in CalPERS, but in addition, those 5 years must be with San Benito County, and that they must retire from this county in order to qualify for health care. In this year, 2026, we were talking earlier, Sheriff was talking about the employee contributions. These are the contributions that the county makes on behalf of employees. These are only the county's cafeteria plan healthcare contributions. It's important that you recognize that cafeteria plan is different. So if, for example, the board decides to give an increase in cafeteria plan contributions, that will necessarily mean that the OPEB obligations have changed. And that will require a change, that would require, an actuarial valuation to recognize what that change means to the net OPEB liability. So as you can see, the active employees receive $750 now per month. Retired classic members receive $750. And but if a retired classic member is now eligible for Medicare, which is age 65, the retiree only gets 70% of the contribution. Now, that's for classic retirees. There are, what we call tier 2 retirees. They will not receive these employee contributions. Those tier 2 employee healthcare contributions are for employees like, here's the list of the bargaining groups, SEIU employees. If they're hired after October 1st, 2013, they would not be getting those when they retire, they would not be getting those contributions. They would be getting, the PEMCA minimum, which I talked about earlier. The PEMCA minimum is 100, will be in 2027, 167 a month. So in order to deal with the OPEB obligations, the GASB, Governmental Accounting Standards Boards, issued, these are the most current statements, statement 74 and 75. Now, statement 74 supersedes the GASB 43, and this accounting standard requires that there be a biannual valuation report by an actuary, and that the funded status of the OPEB plan be presented in the valuation report. Now, GASB 75 basically outlines how to measure the OPEB liability and how it should be reported in the financial statements. So the valuation, again, measures the net OPEB liability associated with the OPEB benefits. And also, more importantly, very important, is that the actuarially determined contribution, the ADC, is stated in that report, and it covers 2 fiscal years. The ADC is really a target contribution. It's not a precise number to know exactly how OPEB liability, will change with that contribution. But it's a target, and we use it in our budget to, if and the county does have that currently, if the county has a policy of fully funding the actually determined contribution. And, we currently have that policy, and that's why we use it for budgeting purposes. In addition, the county's actuary computes the implicit subsidy. The implicit subsidy is it's a number that they're required to compute, but that implicit subsidy is nothing more than the cost of healthcare premiums that are currently we're currently being charged on behalf of employees. And what that subsidy is, that implicit subsidy is, because we have retirees as part of the group, and retirees' costs are higher because they're older and then, see a doctor more frequently, and those costs are high. The premium is reflected at a higher amount because we have a older group. And so that's computed as part of the GASB standard. You'll find this information about the GASB 74, 75, the OPEB plan in the county's ACFR. This is note 15 in the county's ACFR. You'll see all that information in there. Now, back in 2009, at that time, GASB 43 and 45 recommended that in order to control the costs associated with OPEB, that the board adopt a IRC 115 irrevocable trust. And the board established that trust in 2009. There's a few requirements associated with this trust. One is that the participant has to be participating employer. Excuse me. Has to be a state, a political subdivision like the county is, or instrumentality whose income is excludable from the IRC Section 115. It requires that the trust be irrevocable. Assets placed in a trust must be committed irrevocably. Funds cannot revert to the employer unless all plan obligations to beneficiaries have been entirely satisfied. That means pretty much, this is, pretty much in perpetuity as long as you're part of the PEMCA. The trust funds must be accumulated and applied exclusively for the benefit of the OPEB obligations, which are to retiree health care and their eligible dependents. The trust funds must be held and accounted for separately and be not in the general fund of the county. And there must be formal authorization, what the county did in 2009 to establish the irrevocable trust. So in 2023, the healthcare trust value on 6/30 of 23 had grown to $29 million. In 2026, March 31st, which we haven't completed the whole fiscal year, the value of the portfolio is now over $36 million. So in 3 years, it's grown $7 million in value. And this is, I believe 2 years ago when I made a presentation to the board, we brought members of PFM here to talk about the irrevocable trust and how assets are invested. And we lowered the risk level of that investment portfolio such that we dropped it down to 40% to fixed income and cash of the whole portfolio. There's about 55% in equities and the mostly domestic equities. And there's some international equities, but they also have another 5% in other growth instruments like REITs. So this is not what we call a high, an aggressive portfolio. Okay, so again, this is the old valuation report. This is not the most current. But what's important to note here is that here in the 23-24 column, the OPEB liability at the end of the year, total OPEB liability was $35 million. But with our plan assets, the net OPEB liability ended the year about $6 million of net OPEB liability. That means we're about 83% funded back in 2024. Also, very important to note is that in the line where it says benefit payments, in about the middle of this schedule, there's $2,023,000 that number there. Those benefit payments are what we are annually asked for reimbursement from the trust to the county to reimburse the county for payments that we're making to retirees for healthcare. So you could see there every year, those payments, those benefit payments have been steadily coming out. So this fund has grown in spite of the fact that we've been taking out over $2 million a year and adding in, you see above that, a few lines above that, you see the employer contributions. You see that those contributions have been substantially less than that. And so this trust has done exceedingly well. This is the actually determined contribution that the actuary has presented to the county. Let's see, this is line, the actually determined contribution for fiscal year 26-27 is $1,100,000. About half of that ADC is a general fund obligation. The rest of it is paid by the subvented funds. As I mentioned, there's an explicit and implicit component to to OPEB, and that's why there's 3 columns there: explicit, ADC, implicit, and then the total. So that's why we get the $1 million actually determined contribution. So the recommendations are that we continue what we're doing, that we continue to draw from the trust to reimburse the county for payments that we're making on behalf of retirees. And that really important that the board continue to be committed to fully funding the actuarial determined contribution as the official employer policy. And that I come back after, after we receive the actuarial valuation, the most current one, I can, present those numbers to the board at that time.
Thank you.
Are there any questions?
Yeah, thank you. Board have any questions? Supervisor Curl.
So, Joe Paul, the policy is to 100% fund. I know we can't take from the trust. We can't take money out of the irrevocable trust. But is it true that we have in that 115 trust, is that considered a backup trust based on future increases of healthcare costs? Or is it just, I'm trying to wrap my head around it. I read through the ACFR, I've done some research online, and the research online is saying that is a, it functions as a rainy day fund. And so I want to make sure I'm understanding it's not a rainy day fund.
Well, no. I think maybe there's some confusion over, because this is a this trust that we have is both a pension trust and an OPEB trust, even though they're kept completely separate.
They're totally separate.
Yeah.
Yes, they're totally
The
separate.
pension trust is considered a rainy day fund. And it has, as part of the policy to access that money, which is over $5 million in there, that the board has the option to be able to use those funds to pay for pension-related costs only.
Right.
So CalPERS, contributions, those kinds of things.
So, but that money can be used for paying those costs. So where I'm going at with this is there any way that a policy that we have from the past can be revisited so that in an interim period of time, we are able to reduce either how much we're contributing so that that money can bridge, I'm trying to do like a bridge gap here of where the money's going and shifting it to our urgent items right now.
Well, only, if we're only talking, this is unrelated to OPEB. If you're talking pension, you can, the funding policy for the pension trust is really has to do with the unfunded liability associated with pension. And that lump sum payment that CalPERS presents every year in their annual valuation of pension liability, that unfunded number that we have to pay, it's a fixed dollar amount. If we pay it over, if we pay it in as a lump sum, CalPERS allows us a small discount. And that small discount is how we actually continue to fund that, that trust. If interest rates, make sense to do so. Because if it doesn't make sense to fund it because our interest rates are higher, earning in the county treasury, we wouldn't want to, pre-fund it.
Right.
That's how we fund it. It's a very small amount, but nevertheless, it's an annual contribution towards dealing with pension liability. Yes, the board can change that, especially at the budget hearings. The board can make that policy change.
So do we have, because I didn't see that policy attached to this agenda, can we get a copy of that policy and have a conversation about just that one thing?
Yeah.
Is that something we could do? And then how many counties in California have a policy to fully fund their OPEB or fully fund, OPEB? Do we know?
I don't know. I don't know.
I did a Google search. Not many. So I'm trying to come up with a creative way of saying, is there a way that from this expense, we can relook at it and maybe soften the blow on the departments that are being impacted so badly?
Well, you can't, what you're talking about is basically not paying the $550,000 from the general fund for that contribution this year, for the ADC, the general funds portion of that contribution. Yeah. If you will look at this report here, the contributions have not always been associated with the target number, the ADC number. In 2021, it was decided they weren't going to do the ADC at that time. The board had, similar concern with, spending too much money for OPEB. And as a result, if you look in 2021, there was a change in benefit terms and benefit assumptions that completely changed from having a positive
To a negative.
OPEB, from having a positive OPEB liability to a negative OPEB
Right.
liability. And that, we were 130% funded, but the previous year, the policy had changed not to do the ADC. And as a result of not doing the ADC, the assumptions you see in 2021 went up to $8 million positive. When it was brought to the attention that, hey, you know, our liability's gone through the roof, maybe it's a better policy to fully fund the ADC, because these liability payments continue to, you know, grow. And the reason for that is the actual, even though this plan is doing fabulous as far as investments are going, you know, investment returns are very, very good. The reason for that is that the OPEB actuary has to use a lower discount rate in order to comply with the GASB 75 requirements. Yes. And so using the lower discount rates, the relationship between net OPEB obligation and lower discount rates is that they're inverse. That means that the lower the discount rate, the higher the liability. So the board at that time reversed itself and said, no, yes, we're going to continue to provide the ADC as a policy. And as a result, the following year, the OPEB liability, decreased considerably.
It's a flow, you know, if we are in desperate times, I'm just trying to find where can we possibly not spend money for a period of time while we're in such a crisis. When I go back to the list of minimum contributions, I believe it is from the PEMPRA, I'm saying that wrong, PEMPCA, and it shows each one of the bargaining units, and it shows the years that they were included in that. The sheriff's deputy, are these specifically for retirees only, or are these for deputies that are active?
Are you speaking of the
March 24th, 2026 is when the two-tier employee healthcare happened?
So what this is that this is a date certain that if any employee is hired after these dates, they're not considered classic members for OPEB purposes.
Right.
Right? Only OPEB.
Only OPEB.
And that means they're a tier 2 participant as an active employee. And that means they're only going to receive the PEMCA minimum.
Right.
In future years.
It's a benefit if you're a classic.
It's a greater benefit.
If you're a classic.
But even being a tier 2, that is a benefit because we're still committed to, the county's still committed to providing the PEMCA minimum payments.
But only the
which
minimum.
Each year increase.
The reason I'm asking is how many of our sheriff's deputies are hired after the March 23rd, 2026 or 2016?
Right.
You don't know.
That's
Okay,
not-
that's okay. I'm just trying to be creative here and try and find a way of where we might not have to fund fully. I'm not saying not to fund
Well,
ADC.
I would recommend that whatever the board does, it should not be incurring more liability, OPEB liability. And what the board did a couple years ago is to adopt a group health reimbursement arrangement. If you recall that arrangement was adopted and additional funds are paid into for active employees only.
Right. Basically, if you're retired, you don't get that reimbursement because you're not an active employee. Retirees do not get that benefit.
Because it's not a cafeteria plan
Right.
payment. That's why.
And that I mean, if you're a retiree or soon to be a retiree, any increases in healthcare in those areas are going to be a negative for you if we're doing this contribution or this reimbursement, which is a loophole to not have to include retirees. If you have no suggestions on any way we can creatively use OPEB to be able to, or the funding of any of these, I know we can't take from them, but in a short term, moving forward, is there any creative way that we can use any of these to be able
Well, there's
to,
only one way, and that is for the board to say,
the ADC?
you know, they're not funding the ADC.
But does it have to be an all or none, or can it be a portion?
No, the policy has to be that the board is committed to fully funding the ADC.
That's what the policy has to be?
Yes.
Okay. Thank you,
Mr.
Joe
can
Paul, for the presentation.
Piggyback just to get more clarity. So you couldn't reduce the ADC by a percentage, let's say for a year, not saying that we would want that.
I believe that the GASB standard requires that there be a formal commitment by the board to fully fund the ADC, and that triggers the actuary to be able to use a higher discount rate, the one that we currently use. And that higher discount rate means that our OPEB, net OPEB liability is lower. And so for financial statement purposes, you know, external agencies that are looking at the county for, hey, how well the county is run from a fiscal standpoint, are they meeting their obligations to their employees and retirees? Yeah, they look at that. They look at see, you know, how well the OPEB is funded. That's been a big plus for this county when we've gone out for COPs.
Thank you. Thank you. Do you have any other questions? Okay, thank you, Joe
Right,
Paul.
thank you.
So we have several more of these presentations, but I think there's some public comment from some staff, and I want to make sure we give them an opportunity right now to speak on what's been said so far, and then we'll return the presentations just so they can get back to work if they want. Do we have any public comment on the presentation from the auditor or the sheriff at this time?
If you'd like to make a comment, please provide a speaker card or come up to the podium. State your name. On Zoom, please press *9 or the raised hand icon.
We have.
No, this is one item.
Good morning, Chair and members of the board. My name is Tyler Casillas, Vice President of the San Benito County Deputy Sheriff Association. Today, I'm talking as the Vice President and not as the Deputy Sheriff. I appreciate the opportunity to speak this morning on something that is incredibly important to our membership and to the residents of the county. Since December of 2025, the San Benito County Sheriff's Office has lost 6 sworn deputies and sergeants to other agencies. And by September of this year, we are expected to lose 3 more. I want to put that into real terms. 1 full patrol shift for the San Benito County Sheriff's Office is 3 people. In less than 12 months, we will have lost the equivalent of 3 full shifts per staffing. Those are not just numbers. Those are real people with real families who have made the difficult decision to leave because another county can offer more and a better life for the same dangerous work. The deputies who remain are showing up every single day. They are stretched thin and they are tired, but they keep coming back because they love this community and they are proud to serve it. So that loyalty deserves to be recognized. And right now, we have to be honest with ourselves about whether we are doing enough to recognize it. The proposals before this board today are a step in the right direction. The retention bonus speaks directly to the men and women who have chosen to stick this through these difficult times. It tells them that their commitment has not gone unnoticed and that this county values their service. The lateral transfer longevity credit recognizes experience and rewards loyalty in a way that makes staying in San Benito County generally worthwhile. When we invest in the people we already have, when we give them a real reason to stay, everything else starts to fall into place. A stable and experienced workforce is the foundation that public safety is built on, and these proposals move us closer to that foundation. The DSA is encouraged by what is on the table today, and we are hopeful this board will move forward. We are committed to working alongside county leadership every step of the way, because at the end of the day, we all want the same thing: a strong sheriff's office and a safe San Benito County. Thank you for your time.
Thank you. Again, I want to reiterate that we will be taking public comment again at the end of the presentations.
And then Mr. Jeremy Sedeno.
Good morning, members of the board. Good morning, members of the community. My name is Jeremy Sedino. I'm currently assigned to the Detective Bureau of the Sheriff's Office, the only general crimes detective. In different departments, we obviously have, there's different departments within just the Bureau itself, such as homicide, sexual assault, property crimes. In this agency, I do it all. So whatever the case may be, it comes across my desk, I do it. And I want to take you guys back to June 7th, where we had a homicide of a 2-year-old at the hands of his father. It's probably the hardest case I've ever done in my law enforcement career. I know it rocked the community of San Benito County, but tying this back into staffing, it was an all hands on deck. We actually had 2 deputies working that night when a third was actually holding over for an 18-hour shift. And then that's when I got the call at 1:30 in the morning, and I had to respond out there and see this little 2-year-old baby getting worked on by fire AMR as well as our staff. With staffing being so low, just trying to, what this all means is that when we respond to calls, we're tied up, and whatever the case may be, if it's a shooting, we can't go anywhere. We legally cannot go anywhere because we have to preserve the evidence of that scene. I remember when I was working patrol in 2022, 2023, I believe, and we got dispatched out to a shooting, triple beep, and so we all go code 3 out there at Monterey RV Park. In the meantime, there was an act of domestic violence where there was a girl getting beat up by her husband, and that was in the Fairview block of things. Response times, obviously, 25 minutes if you're not driving code 3. So having 2 deputies per shift, it's very unsafe. And I just want to say we appreciate you guys very, very much for working with us, recognizing our staffing concerns. I know it is a very, very dangerous time in law enforcement because violence against us is basically encouraged in mainstream media today. So I just want to say thank you. Thank you guys for your time. Thank you for working with us, and thank you for understanding where we're coming from. Obviously, it's not a slight to any other department. I recognize that there is staffing concerns all throughout the county right now, but it is very, very dire that through points that have already been brought up. So thank you very much.
I have one on Zoom. Stacy McGrady, you've been unmuted and you have 3 minutes. You'll need to unmute on your end, please. There you go.
Hi, good morning. Thank you, board. As I came into the meeting today, and I'm sorry I had to leave, but there was discussion about taking bold action, bold measures, things to stop the bleeding. And I think it's not a surprise. Measure A is fiscally devastating our county, our community, our ability to recruit and retain good employees. It's not a secret. Everybody knew this was going to happen. It was predicted, and now here we are. So if our supervisors are going to take bold steps, bold measures, then they need to become business friendly, support development of businesses that generate sales tax revenue, because it's business and sales tax that support a community. It's not the property tax, it's the sales tax. And we need to be a business-friendly community, develop the business nodes on Highway 101, generate sales revenue income so that we can have appropriately staffed, appropriately equipped public safety, law enforcement, and fire. Thank you.
On HR1 next.
Right. Good morning, Honorable Board of Supervisors and Community. My name is Dr. Amanda Duffy, and I'm the Assistant Director of the Health and Human Services Agency. I am here to present an update on House Resolution 1, or HR1, with Rachel White, the interim director of the Behavioral Health Department. In the context of budget, this presentation will be narrowed to potential financial impacts, not program-specific changes due to HR 1, of which there are many. I say potential because we are still learning and understanding the full impact of HR 1, and we are monitoring what those changes may be for us here locally. There are three main areas we're going to talk about today, which is public health and healthcare, county eligibility workforce and funding, and behavioral health services. So an anticipated impact of HR 1 with public health and healthcare is we will have more uninsured local residents. This will create an increased demand for indigent care services, which we are legally obligated to provide. It may leave more uncompensated care through county support systems or emergency services. There will be loss of federal funding, so less Medi-Cal dollars locally may have an impact on health systems and could cause financial strain on hospitals and public health systems. With the county eligibility workforce and funding, new verifications for both Medi-Cal and CalFresh, which leads to more paperwork and complex cases that take longer to process. This will have increased workloads with loss of resources and creates greater workforce strain with longer wait times for residents with higher administrative operating costs that HHSA has to cover. And for behavioral health services, these impacts will include reduced federal funding, more loss of coverage for residents in need of mental health and substance use services. There will be greater demand for crisis and safety net services. And with the increase in need and cost, it will be harder to maintain critical services. As stated, we will likely have a higher need for indigent care. The County Medical Services Program, or CMSP, was established in 1982 after Medi-Cal eliminated coverage for medically indigent adults. The Welfare Institution Code requires counties to be legally obligated for some indigent care. Indigent care requires every county to relieve and support all incompetent, poor, indigent persons and those incapacitated by age, disease, or accident to meet the residency and economic needs criteria. It is a last resort safety net for basic life-sustaining care. CMSP is a state program administered by the California Department of Healthcare Services to help smaller counties serve medically indigent adults. It is a pooled risk health benefit program for counties with populations of less than 300,000. The good news is CMSP helps us locally with potential coverage gaps for our most vulnerable residents in San Benito County, and we have opted into this program. So we have been a part of this program. What's the cost for CMSP? In the past, we had an annual contribution of around $37,000. This fee has been waived for fiscal year 25-26 and for 26-27. So pre-Affordable Care Act, San Benito County had approximately 820 enrollees in CMSP, and in fiscal year 25-26, we have 10. We anticipate this number to increase with the Medi-Cal changes, and we're also anticipating eligibility and benefit changes to occur within the CMSP program, which would include changing the income eligibility, could potentially include income eligibility, the reinstatement of asset limits, and reinstatement or updates to share of costs. But these changes are tentative and subject to public hearings, which is why estimating the impact is challenging. But the fact that San Benito County is enrolled and is a member of the CMSP does help mitigate our indigent care obligation and does reduce that healthcare gap locally. So I am going to shift us over to administrative funding impacts for Medi-Cal and CalFresh programs. So budgeting and health and human services agencies for these programs is complex. How our administrative funding works is HHSA receives an allocation or cap from the state for administrative costs. Eligibility staff document their time through quarterly time study, and this time study helps us identify how much time was spent supporting these programs. Then administrative costs like salaries, benefits, technologies, facilities, and support services are allocated to the respective programs. So for Medi-Cal, for fiscal year 25-26, we received an allocation of approximately $2.8 million. And we are budgeting for approximately the same allocation of $2.8 million for 26-27. The way it works is it's a 50-50 split between the federal and state government up to the cap amount, which is the $2.8 million. Anything over that is 100% up to the county or Health and Human Services to pay. So for Health and Human Services, anything above that administrative costs hits our realignment and then our fund balance to cover those. For CalFresh, the share of costs is a bit more complex. The share of costs has been 50% federal, 35% state, and 15% county. Health and Human Services budgeted share of cost for fiscal year 25-26 was approximately $784,000. With HR 1 and the administrative cost sharing changing in October of 26, the costs will now be 30% federal, 48% state, and 22% county, which increases us from 15 to 22%, which is about a $300,000 increase for Health and Human Services. So part of the reason we talk a lot about the increase in workload for eligibility staff is for our concern for staff. More time required per case. We need increased training, and we have to ensure that we are administering these programs appropriately. And longer processing time for residents. So effectively, we are increasing our administrative costs without an increase in our allocations. But we are working diligently to stay within those allocations as best as we can, and working with the state and looking at all different opportunities that we may have to leverage new tools, as far as what they're providing to us to support completing the work more effectively. So CalFresh, for example, as I said, a lot of these are assumptions and estimates. We just implemented June 1st, the work requirement for ABOD, or able-bodied adults without dependents. That's around 1,030 residents. 250 of them are age 60 to 64, and around 80 are families with children over the age of 14. The average benefit per month for a single adult is $194. That equals around $200,000 in potential lost revenue to businesses that accept EBT and those individuals that need that money for food. The hard thing about these programs, again, is we don't know who will be able to work and maintain volunteer hours, and it hits in a rolling pattern as they have recertification. So on average, we're anticipating around 70 cases per month that will have these new requirements, and we don't know of those 70 cases how many will fall off or stay on. And so that's where we say monitoring these impacts is what we're really looking to do. So comparatively for Medi-Cal, when individuals lose coverage due to changes in the requirements, individuals will no longer seek health care. There'll be a loss of funding to healthcare providers, an increase in emergency room visits, and the overall wellness of our community is at risk. This creates opportunities for more public health concerns. We are doing everything we can to help our community members stay on these benefits. And we are working hard to collaborate with, Community Foundation. We're doing a panel discussion later today to talk with other nonprofits in the area to figure out what are these things that we can do to help support and to leverage our local resources to really lean in and ensure we're doing everything we can here to keep folks on benefits who are eligible and supporting them through volunteer and work hours. And we are still waiting as well for the state budget to see where that lands. There's a lot of advocacy with the California Welfare Directors Association around these additional costs that could impact locally, and we're waiting to see where that lands with the budget. And with that, I will turn it over to Rachel.
Good morning, all. In regards to the behavioral health, the impact that we're seeing is mostly going to be for ages 19 to 65. With the implementation of some of the things through HR 1, such as the community work requirements, Medicaid 6-month redetermination, and qualified non-citizen definition being changed from full scope to restricted, we're going to see some penetration. It's not going to be as much of an impact as Health and Human Services is having with all of their programs, because we only have a 0.01% penetration rate in regards to those who are on Medi-Cal receiving mental health services. And so the following slides will kind of show you what the fiscal impact will be upon us. For 26-27, we're seeing about 23 individuals that will basically need a community work requirements and need to meet those under these new guidelines. And that will have an impact of about $286,000. And as you can see here, in total, there's about 47 individuals that will be affected through this. And the reason the number is so low in 26-27 is because some of these programs are starting mid-year. So this is a mid-year review of what that will look like. And we will have about a $496,000, close to a $500,000 impact on our system. for fiscal year 27, 28, we'll most likely have 186 people will be affected and about a $2.1 million impact. The way that we are kind of planning to address that, and then we'll go into the youth, is that we usually are going to be utilizing our Behavioral Health Services Act funding that is available to support those in the community that need this level of support and help. We also have our realignment 1991 realignment and 2011 realignment that we can utilize. And on top of that, the staff themselves who meet with clients are able to Medi-Cal bill. There's no cap to the Medi-Cal billing that staff can do in the direct client care they give. And so we're really promoting the staff to increase their productivity, increase their contact with the community, and therefore it increases revenue for the department to build programming and support for those who need it. This HR1 will have an impact on youth 0 to 18 years. We're seeing about 240 youth that may be at risk for disruption in regards to their coverage and care. That'll be about 38 children approximately per year who are expected to have Medi-Cal, a temporary loss of Medi-Cal. The consequences are that there may be a loss of some of the high needs services that we are. Behavioral health is a specialty mental health service, so that means we serve the severe in the community. There's also an impact, an increase of an impact on our behavioral health system, especially under our lower end tiers services that happen through our Behavioral Health Services Act. There'll be impact on our schools and also on the crisis services that are needed. So total impact per year for the youth that will be impacted is about $38,000 a year. Again, it kind of just destabilizes, HR1 kind of destabilizes access, especially for children, but we are working within our department to try to cover that by utilizing the available funding we have and also promoting the staff to do billing. Again, billing is the key for us to build longevity programming for our system. Within behavioral health, we used to get paid upfront for the services we get. Now we have to work to earn. So the staff are really doing their best to increase the billing and increase the revenue. And the only way they could do that is increase the care. So there will be an impact. And so we're going to try to balance it out so that there isn't also staff burnout. And that's something that we need to closely monitor. So other impacts upon our system. Our system is being, just to let you know, about 20 bills, Assembly bills and Senate bills have passed in 2025 that have an impact on the behavioral health system. And this requires us to expand some of our programming. One of those things was court mandated services. There is no funding to support the court mandated services that behavioral health has to participate. CARE Act is one of those items. There is upfront for implementation funding. We do have that. We finally do have CARE Act recipients, and so we're able to use some of that implementation funds. And then there's Proposition 36 that came into effect, and we did get a grant to support us with the implementation and seed funds to run Proposition 36, but it's only available until 2027, and then we have to figure out how to fund that kind of program and continue the funding for those court mandated programs that are coming. And the court mandated programs for behavioral health are only increasing over the years as we begin to get more involved in our court systems. Also with the passage of Proposition 1, which is the Behavioral Health Services Act, we got introduced to having to participate in the housing initiatives. Behavioral health has never been part of the housing initiative, so now that we are, and Proposition 1 has basically stated it's a mandate of behavioral health, we are working closely with Health and Human Services, who is participating in that, and we have to create longevity in housing and permanent housing for those with severe mental illness and substance use disorders, as well as evidence-based practice. We were able to, out of 10, I believe, evidence-based practices that were mandated to perform, we were able to be exempt from 3, but we still have to do the other 7. So these require extensive training for staff, extensive mandates, staffing structures that need to implement these evidence-based practices. And also the expansion of LPS for basically 5150s. 5150s were usually for those who were gravely disabled, severe mental illness, due to severe mental illness. Now substance use disorder is part of a 5150 process and is considered gravely disabled. So it expands now that who we need to serve and how we need to serve them. And so substance use disorder becomes a 5150 crisis whenever that comes to be, and we need to find placement in housing those individuals that need to go into an inpatient hospital unit. So those are some of the changes that are coming in the impacts upon the system. And everybody's working hard to try to figure out how we're going to make this happen. And the state is continuing to bring us things that we need to complete, and everybody is working their best to try to support the community the best we can. So these continuous impacts will help us, will build over time, and as all provisions will roll out in phases, nothing's coming at once, as well as evolving information. We're not 100% sure what this will look like, so kind of that saying, you know, you're building the plane as it's flying, and that's kind of what HR1 will be, and the implementation of it will look like. It's hard to predict what the final impact will be as these start to roll out in stages and phases. And we don't know basically the entire impact on the community. The estimates I gave you on the behavioral health are just estimates. They're not set in stone. They will change and alter. I know that our association, the California Department of Behavioral Health Association, is doing their best to try to advocate to add additional funding for these mandated services that are coming. But we don't know what the end results are. So all we can do within our department, and I believe as others' department, is just continue to have the staff do the best they can to provide the services they can to the community, and then try to do some strategizing for long-term solutions. And then any resources, so if you have some reading time, there's a resource page. Feel free.
Thank you.
But that's it. Thank you.
Thank you. Any questions from board members at this time in the presentation? Yes, Bridget Crowe.
So thank you so much for the presentations. I know that HR1 has really impacted all of the communities. It looks like from the state budget, money will be coming in for indigent care and struggling hospitals, but we did kind of, I guess, escape another major impact, which is that in-home care, for seniors, it's the in-home supportive services. The governor vetoed that portion. That would have been another push down from the state on services to have to be covered by the county. Are there any recommendations from you or your departments on what programs that as we move forward that are not being funded? For example, you stated two of them, I believe, that they're going to fund through the 37,000 is waived for this current fiscal year and this next fiscal year through 2027, but it will not be waived after that. So that's going to be a future cost.
It could be, yes, for the CMSP program.
Right.
Yeah, and that's in the Welfare Institution Code statute, what our share of cost is to buy in, to be a part of that program.
Waive only is for.
But the waiver was only for, and they've been waiving it for a few years, but for this fiscal year and next fiscal year, we just received the letter, they are waiving that $37,000 fee for the county. But we don't know what will happen after that, after this year.
So with these programs that Rachel, that you mentioned, that they're only funding like the startup of the CARE Act program, they're only funding a portion of what we're doing. How are we, do you have enough in reserves, in the subventive reserves, to be able to take these hits that we see that are coming? Because where the conversation's at the state level is, well, how much of your general fund can you contribute towards these problems? And I keep telling everyone, none. We got nothing to give. I mean, we are literally the turnip that you cannot squeeze any more money out of us. We have no money. So having those conversations and understanding that your reserves are the most important and valuable things that we have right now, will your reserves hold us over until we get a better handle on HR1 and the impacts?
The reserves will hold over for a short period of time. It's not a
What's a
long-term
short
so-
period?
Short
Couple
term, I
years?
would say a couple of years, 2 years at the most. The only way we could shore up the amount of funding that is coming through is through really working with our staff and our contractors to bill and bill accurately. Again, we could bill, sky's the limit for Medi-Cal. And the only way we could, and it's at the discretion of the department and the county of how we utilize those Medi-Cal dollars. And so we could bill, again, our productivity standard for our department, as an example, is 70% productivity. That means you need to provide.
We're below the threshold, aren't
We're
we?
below the threshold for
Right.
that. So in order to increase that, we really need to train the staff on billing coding and make sure they know how to do that accurate. Train the staff on sending out the correct billing to the state to get reimbursed, and then monitoring that to ensure that we have continual revenue coming through, so that way we could build a reserve for future planning.
And that's very similar to the challenges that the hospital district had. Their billing was their outdated problem. And once you tackle your billing, you had stated that, I'm not sure which one of you stated, that you do time studies, as opposed to doing time tracking. Is there a reason why time tracking I know you guys have lots of codes, lots of issues. Time studies are not as accurate as time tracking. And when I say time tracking, it's that you are actually tracking your individual staff members' time on multiple billable projects so that reports can be run instantly on how much cost you've had expended, so makes reimbursement more efficient. Is that even a possibility, or are there programs or vendors like the vendor that the hospital brought on that could improve the reimbursement process? Just throwing out ideas.
For behavioral health, we are doing time tracking.
Okay.
Because we are able to get reimbursed for time utilized. So we're able to pull down our administrative rate.
Right.
From the state in order to cover the administrative or the indirect cost for doing that level of care and service. And we're also able to pull down quality assurance, utilization management, and review. So I need exact time.
And that's,
so we have project codes developed.
Project codes, perfect. That's what you said, the magic word, project codes. Because if you have a project code, you know you're going to be able to bill it out. And when you're able to bill it out, you're not going to have the argument with the state because you have the documentation in the time, in the time tracking software. Okay, that's great. I know it's a challenge right now. We're going to have to come up with very creative solutions. This is where realignment and having that conversation about realignment and really pushing at all department levels that if we aren't being reimbursed for these state mandates, we've got to push for a realignment conversation, which I hope to have started in December with CSAC. So we'll see how that goes. Thank you so much for your presentations.
Thank you. Any other questions, comments? Thank you for the presentation. All right, next we have Public Works, presentation on Measure G and SB1.
Good morning, Mr. Chair, members of the board. Adolfo Gonzalez, Consulting Engineering Manager with Public Works. Today, I will be presenting to you Measure G and SB1 roads funding. In Measure G funding currently as of June 22nd, 2026, we have approximately $8.1 million in funding available. Of that, at least 6.5 is still committed to that fund. What you see up, the table that you see above here are the current projects that are currently budgeted in Measure G funding. we've expensed to date 2.7 million, which still leaves us a balance of about $6.5 million committed of the 8.1 balance. That leaves us with $1.57 million in Measure G funding available. Currently, we have a grant in the amount of $9.53 million for SS4 projects. That grant requires a matching contribution from the county in the amount of $1.9 million. We're proposing to do is to use the available $1.5 million in the Measure G fund that we have, 1.579 plus, and put that towards the matching funds for the SS4 grant. Measure G allows us to do that. However, we're still short just over $326,000. So our recommendation is to suspend or defund some of these projects that are currently programmed to come up with the additional $326,000 funding shortage for the matching grant. In SB1 funding, we are anticipating receiving approximately $3.15 million for the upcoming fiscal year. This is a list of the projects that could be selected to be funded with these available incoming funds. So there are two options. Well, there are 8 options available. And we're seeking the board's direction, asking the board to select projects off of these 2 lists, which total no more than $3.15 million. Oops. Thank you. And with that, I can answer any questions you may have.
Good morning. I just want to clarify one point. If you go back to the slide, the measure funding, please. And the following is the second one, actually, when we had the gaps. So in Measure G, we confirmed this with COG about the funding that we have available and the potential uses. So we have it in writing that those are the funds that we have available. Those are projects that were funded at a one time. And I just want you to understand that some of the expenses that you have there are for engineering services that have been incurred so far. So the projects are ongoing. And suspending any of those projects to be able to make up for the $1.9 million that we need as matching funds to secure the $7.5 million, we're not asking you to delete those projects, but rather to suspend the projects until we have the final budget, if you want us to proceed that way, so that we can maybe reallocate some of those funds if we have available in the future to continue with the projects. But I want you to understand that we're not asking to delete those projects, we're asking to put a pause, because if we don't secure the additional $1.9 million that we have in the following slide, we will not be able to have a total of $9,532,000 for the projects that were submitted for the SR4. So we, 4A, I'm sorry. So we asking you to consider that this, I would rather not have an approval yet. We might want to think about this, because when we come in with the final budget, you will have to make a decision about how to proceed with those projects. But I want you to make you aware that some of those projects are ongoing for planning grant, engineering designs and everything. So you don't have much room. We need $326,000. If you were to ask me to suspend some of the projects, I will consider the last 2 projects on the list that you have, because that makes about $328,000. which is the San Benito Nash and Union Road with intersection control. You remember that project, as well as the McCloskey Road. It's $150,000. That has not started any engineering designs. But those two, total amount available for those two projects are about $328,000. So that could be an option for you to be able to make up to come up with the funding that we need for the other grant. Otherwise, we will not be able to proceed with the grant and accept the grants if we don't have the matching funds, because we need to present the matching funds to the funding agency.
Thank you. Thank you. And just before we go to questions, remember to clarify, those two, we haven't spent any on the McCloskey one, and we've spent 21,000 on the Nash.
Yes,
Union.
so
Those
far.
are the two amounts, like the two least we've spent so far.
Yes, so if you read into the third column,
Yeah.
fourth column, you have available $178,000 and $150,000. So if you add those, it's $328,000. So when I was doing the numbers, I realized that those are the two projects that you could potentially suspend, not delete, just suspend, to be able to come out with the $326,000 that we need as matching funds for the $7.5 million that are still sitting there until we make that commitment. And that will come to the Board of Supervisors with a resolution approving those funds to suspend those projects and to continue doing the matching funds.
Okay, thank you. Any other comments, questions from the board now on this?
So it doesn't look like Cienega from the, basically, I guess it's the HUD, or what's that, Mudstone? Do I have that right? From Mudstone over to the bridge is the only thing that's on there. So
We received this list, so Deems was able to dig into the files, and this is what he found, that the county has made those commitments so far.
So there's been no engineering of any kind on that project? Because if so,
If it's
then
not
I have been lied to by prior staff. And I don't mean to say that so bluntly, but I was told that the engineers were working on that. It was ready. It was just a drainage issue, and then it would be able to be moved forward.
And did you remember by any chance what funding was that?
I have no idea. I can go back through the prior budgets.
What we can do before you make a decision regarding this funding, we can go into the files and find out if there is indeed an engineering done, and whether that project is being funded by another funding sources. We can look into that one if you give us the full name of the project, and we'll come back with you.
I gave you all of the information, including the GIS location, and that the construction was scheduled to begin in 2025.
And that was the last week's email that you sent me? Okay, we'll look into that one when we come back on the 30th. We just want to give you a scenario what we have so far available and the funding that we were provided, and that we confirmed with
And then we had a conversation, is it in a future presentation, about Panoche Road and access on Panoche Road and striping on Panoche Road, but also restabilizing New Idria. I've gotten confirmation from the sheriff. I've gotten confirmation from, I believe, fire, that you need a four-wheel drive to be able to get to those residents. The road's so bad.
And those will be in a future presentation.
Yes.
Thank you.
Okay, thank you.
Mr. Chair, I think New Idria I see is on the SB1. I don't see Cienega on there, but the New Idria Road rehabilitation.
From 2006.
Oh, okay, got it.
So what happened is the following, for my understanding, and correct me if I'm wrong, what she provided me was with a plan that you have adopted years ago. And in that plan, there were several roads. And for some reason, some of those projects are not in the list anymore. We grab whatever was in the list of projects. So her question is, where are those projects and funded with which funding?
If I may, and so, and I was gonna ask for further clarity, and maybe this will help. The SS4A, whatever that acronym is, grant, that if you add it up, that looks is like, is this the CDBG basically?
No, no,
No, it's completely different.
that's
Okay.
completely different. This is only through the state. It was an allocation for specific projects. They're not the CDBG project. The CDBG is another set of projects.
But that dollar amount is an addition, can you explain what potentially we can use that dollar amount for? Because we're talking about matching a grant to obtain a very large sum of money for road improvements, and maybe perhaps that can help address Supervisor Curl's concerns about District 4 that she brought up, and we did say we were gonna talk about District 4 in particular.
The 9.5 number?
Yeah.
Yes, so I have a list of projects for that. Hold on one second. Deems provide us with a list. Let me see, this is our 4.
Well, while you're looking, Mr. Chair, if I may, I've received probably over 30 emails from residents. One of them I sent to council because of it appearing to be a public records request due to a death that happened on Pinoch Road motorcycle some time ago. And I gave all of the statistics of the number of accidents and the number of deaths that have happened off of Pinoch Road, on Pinoch Road, and also the impacts of New Idria and fire access and law enforcement access. My biggest concern here is if we are really strapped as bad as we are right now in safety, which is going to be impacting all of our residents, we have to have even a temporary fix. It doesn't have to be a permanent fix, but a temporary fix that still allows access on these roads as safe as possible. So that's my only request, that we have that conversation.
Excuse me, I have a list for the projects under the S4A. Hold on one second.
What does the acronym stand for? Is that Safe Streets for All?
Safe
Is that-
Street.
Clever.
Sorry, Mr. Chair, if I may. That's the one that is all about safety. And we advocated, well, roads being drivable is a safety concern of ours, not just guardrails, roundabouts.
Right.
Yeah.
So this is the Lofgren
Yes.
one.
I'm having it over here. What happened? Okay. So if you can allow me to show this one in the screen. So this is the list that was provided to us with all the projects that were in this grant application. So we have safe routes, schools and transit. So this is the federal request, non-federal matching funds, which is, if you go back to down the list, these are all the projects that were submitted along with that application.
Can you go a little slower, please?
Yes, no,
I
I'm just
can't
gonna
read that
show
when
you,
you're doing
no,
that.
totally agree. I just wanna show you the bottom part, which is $7.6 million plus $1.96 million that we need as a matching fund. We're gonna go back to the list. No, I'm not expecting you. I just wanted to show you how the list came out.
And while you're doing that, Madam Chair, can I clarify? Because initially we got a list and it was, I'll just simplify it as saying guardrails, et cetera, as Supervisor Curl said, and we expressed that, can we go back to the feds and ask and request strongly that we use it toward road repaving, because those are also safety, and we got a positive response from that. And I think the goal was to be able to get approval to use those dollars on repaving projects that are safety related. And I think that's where Supervisor Curro is talking about some of the South County issues that we have talked about committing to addressing.
So we're gonna post this in the budget today and this, and the website, so that you can see the roles that we have so far approved if you wish to make a changes, we can go ahead and proceed and do the changes. I don't know at that time, if when you made that request, if the changes were made, I don't know, to be honest. And so maybe
Are
they
these
didn't.
repaving projects, or because it only lists locations, it doesn't say anything about, I see design development, but it doesn't say what the actual, we need a
I
little
see.
more clarity on
Okay,
what
so-
the actual projects are.
yes, because I have over here so far. Okay, so it's further down, he said. But it does, the exit road over here, like in Cienega.
Yeah,
Done.
these aren't gonna be
Okay.
repaving, because those are small dollars.
Okay, there we go. So those are the activities for each one of the projects.
Speed warning signs, curve ahead signs, safety edges, signage. So I don't want to speak for everyone else, but this is what we got initially, and we were hoping to make adjustments to this. So I think once we're done with this budget, we really need to make it a priority, again, to go back to the feds and get a firmer direction on being able to make adjustments to this list so that we can address these roads with paving issues that are safety concerns, as Supervisor Curl mentioned.
So what we can do is the following. I just want to be acknowledging the Brown Act, so we can post this in today's agenda on the website. You analyze as a board and you come out with proposals for us to receive direction from you. What would you like to see in the future?
Appreciate that, and but also in tandem with Public Works, obviously, because
Yes,
they're gonna have that list of prospective roads
Yes.
that need to be repaved that we've all talked about, and if we need to add roads to the list, then at that point, we can.
or modify
we can do
anything that is in
yeah.
there.
Maybe we
Yes,
have a discussion once we finalize the initial preliminary budget about getting that approval from the feds and refining that list,
Would-
so that we can address those highest priority safety issues.
so what we can do, beginning August, we can start working as a workshop in public to see what the roads, what the way the grant looks like, the options that you might have, what the engineers available, so they can go over each one of the projects or the required projects that you want to change, and the likelihood that we be able to change those at the federal level. We
Okay.
can do that.
Thank you.
Thank you. Supervisor Curl.
I'd just like to make sure staff is incorporating in, because this is where the history of where road projects are dropping off. If you go to our homepage at the top, it has the link to our current road projects. I mean, it's showing the Cienega Road was going to be starting construction in fall of '25. It shows all of the road projects that this board has been discussing, and they're not all on there, and there are projects on there that are not on here. So I just want to make sure that we bring together this comprehensive list that shows where the funding sources are coming from. I know that our former Public Works Director had that list that showed all of the projects with all the funding locations. So if we can just make sure that we bring all that together so we can see it, because I can't remember every single project. And in South County, I could add probably about 15 more, but I'm trying to be nice and only focus on the 3 that are the biggest concerns of my residents right now. So,
Okay.
thank you.
I have a question regarding the SB1 funding. Last time we had this discussion, the Fallon Fairview Light intersection issue was brought up, and I see now that it's on the list and there is an estimated cost, which is now $1 million instead of $5 million, which is great. But I just want to get clarity. I know it was kind of rushed. How sure are we that this is the number that we're actually looking at? Is this the standard intersection cost? Is that where it came from, or is it anything more specific to that specific spot?
Thank you. So before Deems left on vacation, we discussed this particular project, and we did come, this is a projected estimate of potentially signalizing this intersection as it is currently right now with
Okay.
some modification. We still have to look at the right-of-way because we will need to widen just a little at the intersection to account for left turn pockets. So we are estimating that it will be about $1 million, and that is a conservative figure. Obviously, with the cost of materials, increasing, that number may fluctuate just a little. But we are pretty confident that we are at about $1 million.
Okay, good. That's a lot better than what it was before because we've been pushing this a long time, and I know there's plans to realign the whole road, and it was years away and millions more. So this is definitely something I think is worth pursuing. This is, I'm confident saying, one of the most dangerous intersections in the county. People get accidents here all the time. There's deaths here a lot. This is important, I think, and I would fully support. I know we're going to follow up on all this, but I would definitely support allocating some of that $3 million to this project specifically. I think it's vital for the community.
Thank
So
you.
That's all. So thank you.
I'd like to add, and that's what we're looking for is direction from the board on which projects to include. I also want to state that we will come back on June 30th with those locations, those projects that you're providing direction on. And we will seek your direction on June 30th. We'll need that resolution. June 30th, we have to upload this list into the system on July 1st, no later than, so that we can secure that funding.
Absolutely.
So we're at a very critical stage right now.
Thank you. Sure.
I just want to add on, I just thank you. I think it's really, it's preliminary in a sense because these are estimates and whatnot, but just the work that's been done to make that project realistic. I know that that's just hearing in the community, and I know Supervisor Zanger has, since I've been a colleague of Supervisor Zanger, this has been at the top of the list. And getting this done is just, it needs, is with the limited funding that we have, that Fallon and Fairview intersection, because we're talking about safety again, is critical. And I would say that project, I mean, we're going to refine the list next week, but also just, I think, look, losing our limited resources on that project and then the South County projects, it's definitely time to, to focus and do what we can to address those highest priorities in South County. So looking forward to that conversation. Thanks.
Thank you. Good. Well, thank you very much.
I just want to confirm that by June the 30th, you will have to have a decision on SB1 because we need to submit that to the state.
Mhm.
Okay, thank you.
Got it. Thank you.
So we're going to continue our presentations now with parks. I have a request from us. We actually have Supervisor Sotelo coming with us to a tour to have an idea about the conditions of the parks, some of the parks, the Betts Park. And so I had Salman today to make a presentation about parks. Let us know.
Good morning, Chair and members of the board. My name is Salman Kazmi, Capital Program Manager at Public Works Department, and I'm here to for a presentation on the county parks. So as of June 22, 2026, we have about 6.29 million available in the park impact funds. And during the past years, state grant were awarded to the county for approximately 3.55 million. And for those, for two of the parks, Riverview Regional Park and Sunnyside Park. And for those two parks, the county committed from park impact funds for 3.371 million to the Riverview Regional Park and 300,000 to the Sunnyside Park project for the total of 3.671 million. I can go over on each project and provide details on the budget, what is committed, and what are the expenses to date. And also, I will provide an update on the project. So for Riverview Regional Park, these are two separate grants, Riverview Regional Park Development and for the parking lot for, before it was combined, and for clarity, we did separated both of these projects. So for Riverview Regional Park, it was funded through a California State Park grant of approximately 2.4 million. The project includes a county match commitment of approximately 3.371 million, and it was approved in 2021, resulting in total identified project funding of approximately 5.77 million. The design phase has been completed. However, the current project design exceeds the available project funding and will require refinement to align the project scope with available grant and local funding. The grant currently expires on June 30, 2028. I can keep going for the project, and then you can ask me any questions, or would you like me to pause for every project, and how would you prefer?
Just keep going, finish.
So for Riverview Regional Park development parking lot, the project is funded through a State of California Budget Act of 2021 legislative appropriation in the amount of $750,000 secured through assembly member for the accessibility and public access improvement at Riverview Regional Park. The project was previously bid in May 2022 with the apparent low bid totaling approximately $1 million. However, the selected contractor subsequently ceased operations and the project did not proceed to construction. Based on the available funding, it is not suitable and not sufficient to complete the planned project, and additional funding will be required prior to rebidding and construction. The funding currently remains available through June 30, 2028. For Sunnyside Park development, it was funded through a $400,000 state park per capita grant, and on September 14, 2021, the board approved resolution appropriating $300,000 from the park impact funds for the future construction of Sunnyside Park. The associated board action identified a $300,000 Benito Ranch subdivision contribution toward the park project. Design and construction documents have already been completed, and the current engineer's estimate for the construction scope is approximately $1.68 million. When construction management, inspection, permitting, testing, project contingency, and other project delivery costs are included, the project budget is estimated to approximately $2.2 million. The grant expires on June 30, 2028. Veterans Park Picnic Area Restroom Remodel. The project will continue the renovation on the Veterans Park Memorial Park Picnic Area Restroom. Previous improvements have included roof replacement, electrical upgrades, and installation of new restroom partitions. And upcoming renovations will include interior, exterior painting, some tile work, and plumbing upgrade. Veterans Park lighting, resurfacing, signage, and striping. The design plan specifications were completed by Wallace Group in 2024. The project includes parking lot resurfacing and slurry seal, lighting system improvement, ADA accessibility upgrades, pavement striping and marking, signage, fencing, removable bollards, and related site improvements. The project estimate is $2.2 million. The project is currently shovel-ready and pending funding identification. Historical Park Right Here accessibility device. This project will install a Right Here accessibility system at the Historical Park to improve access and navigation for visitors. The system uses smartphone-based wayfinding technology to help individuals who are visually impaired or have other accessibility needs independently locate facilities, point of interest throughout the park. For Historical Park Portable Water System, the project will improve the portable water system at the Historical Park to accommodate increased visitor demand and support continued public use of facility. And I can welcome any questions.
Thank you. Questions?
Yeah, Mr. Chair, I just want to point out I know there's these grand plans for Riverview Regional Park, which includes a trail to God knows where. I'm kidding, but I've said this in the past that we really do need to parse out what the realistic project is versus, I know we have this longer term vision that maybe down the road, if we get a large amount of grant dollars somehow, it doesn't look like it's anytime soon, that we have that plan in the books for that purpose, but we don't have funding for a $26 million project. And I just want to make sure, because there's the different phases with the regional park, I just want to make sure there's not confusion in the public that we're focused on those initial phases, the park itself in that area, as opposed to sort of that dream of the trail itself that would be miles and miles. So what, again, do you have that dollar amount? Because I guess my point is that, yes, on paper, we have a funding gap of $25 million, but if you take out the park trail aspect of it, it's actually, because it looks like a couple $1 million, which of course that's about the cost of the Vets Park improvements that we want to do, which we do want to do. And hopefully we can find some revenue sources very soon. We're hopeful on some things to get started on that stuff. But I just want to make it clear that the $25 million funding gap, that includes this vision that is not realistic at this point until we maybe get $20+ million in grant funding down the line at some point. Am I wrong in that assessment?
No, you're not wrong. And so the idea of bringing this presentation to you is to provide you with what it was intended at the beginning to do the project.
Right.
But we understand that that will be done in phases. Our plan is to come back with the phases. How much is each one of those phases and what includes each one of those phases to get approval individually by phases. Because it will be impossible to accomplish this in 1 or 2 years. And we will not have the funding available. So we'll come back with the presentation for individual phases. One of the things that I want to make sure is that we have an understanding of the following. As previously mentioned, we went through the parks. We walked through the parks, and we understand that there's a lot of issues with the current facilities. And so you have an impact fees of $6,290,000. The population using the Veterans Park has increased dramatically because of all the development that has happened. And therefore, we need to add additional funding to those parks. Using, and we consulted this with the county council, using a portion of this impact fees is allowable because of the increase in population and the uses of that park. So what we want to make sure is that you understand that you already committed out of this impact fee, the $6.2 million, you already committed $3.5 million. Therefore, you have room for a little bit of less than $3 million. And so we'll come back to you in the final, and the upcoming budget, final budget, with ideas on how to allocate some of those portions, some of those impact fees to be committed. It has to go through a whole process, but we want you to be aware that they still have funding available, and that we need to use those funds for the parts that we have currently in place, serving the community that are not meeting the minimum standards. So that's our intention in presenting today's presentation. We will come back individually with each one of those parks, or whether or not they're going to be done in phases, and you will have to approve individual phases and set aside the funds that we need to do that. If you need to add additional funding from impact fees, that will come back as well in the presentation.
Thank you. Any other questions? Yes.
Thank you. I really appreciate this presentation. Can we also have, I don't mean to push, but I believe there was a future agenda item from a few years ago put forward by Supervisor Kosmicki and Supervisor Zanger about park sponsorship. And I think this might be a perfect opportunity and time for us to figure out what that looks like as a board, and I think make a decision on that. I think there are some things that hopefully we'll be able to fund some of these things using our park impact funds, but also having the opportunity that if the community wanted to, there's some sponsorship opportunities. And so I think kind of going hand in hand, I think we might be able to accomplish even more. So I would like to put a little bit of urgency to get that agenda, that future agenda item back in front of us as soon as possible. Thank you.
So on the Sunnyside Park development, this is a prime example, and I know I'm preaching to the choir here with Supervisor Kosmicki because he is very clear on this. Developers, these developments can no longer have developments where the parks aren't coming first. And they can't put the development of the park on the county, and we have to have the impact fees to maintain that park, because the only way we're gonna solve these problems right now, I will tell you, the speaker yesterday, I totally 110% agree. It is absolutely ridiculous that we have the developments, that we have promised parks, that they were told there were gonna be parks, and there's no park being planned there. I know it's been worked on. I know the design has been done. If we need to reduce design for better maintenance, we need to look at that. We need to look at value engineering on projects and see that we at least are giving the public a place to be with their family and their children that's safe. Because all of these parks are a liability on us, every single one of them. And before we invest more in future parks, we need to commit to the parks that we've already discussed and had promises to the people. Thank you.
Thank you. Thank you.
Any additional questions?
Don't believe so. No.
Okay, thank you. Let me,
I believe we're on to
that
our
was
last presentation,
the last
right?
presentation, then I'm coming back with the budget presentation. I don't know if you want to continue, you want to take a break, however you want to do it. I'm here.
5 minutes.
Yes, please. Thank you.
Okay, Alfredo.
All right, we're back from our break. Thank you, everyone. So actually, before we get back into the presentation, during the break, we went over some things. County Council, I believe we have an update on potentially some additional park funding, right?
Yes, Mr. Chair, members of the Board of Supervisors, I'm happy to report that we are in our final stages of preparing the lease agreement with Verizon regarding an easement for Verizon to continue to maintain its cell tower at Veterans Memorial Park. So the terms of the agreement are a lump sum payment to the county of $545,000, as well as any other entities, other wireless companies who want to co-locate on the tower. The county would receive 50% of the rent received by Verizon. So we will have the lease agreement finalized, and that will be ready for execution this summer. And we expect that those funds will be received this summer. And of course, as you know, those funds have been specifically earmarked for Veterans Memorial Park. We've also met with the Veterans Memorial Park Commission, who under the code is responsible for receipt of those funds, and then those funds will be used as the commission deems appropriate for improvements and maintenance of Veterans Memorial Park. So that's the update. I'm happy to answer any other questions you may have.
Thank you.
Mr. Just for clarity, those are funds in addition to what we've seen, so those have not been accounted for yet in this budget, so those would be additional funds that we could use toward Veterans Park.
That's correct, yes.
Thank you.
Great, thank you.
Thanks for all the work on that.
Good afternoon again. Now we're going to proceed with the budget, proposed interim budget, and I want to emphasize the word interim because it's not a final budget. It's a proposal that is made on projected expenses and projected revenue. And so this helps us to continue operations by the end of the fiscal year, which is June the 30th. Failure to have a proposed adopted budget, approved recommended budget will prevent us from continued operations. And that's the whole purpose of having this proposed interim budget. So with that, I have good news for you. Last week, we were upside down for a little bit more than $500,000. And I want to acknowledge some of the departments that we had to work with to minimize the impacts, to kind of like balance the budget. I work with the Agricultural Commissioner. He was able to provide us with about $175,000 savings. And what he's doing is sacrificing for now the deputy position and kind of like take over the duties of the deputy so that because due to a lower amount of revenue that he will be receiving this fiscal year, he has to, in order to downside the additional expenses for not having the revenue, is downsizing his budget for about $175,000. The other agency was RMA in the Public Works area. We were able to identify $150,000 more. And the assessor's office, thank you very much. He came so willingly to come with us and say, I'm here to help you to meet that amount that we needed to balance the budget. So we came out with about $80,000. The probation department, they were able to identify additional revenue and reduce some of the expenses. And so they have about $80,000. And finally, and this is a decision that I had to make, and I had the UC cooperative extension. They originally made a request for an additional 42% increase in their budget. So I just added 10% and took away $42,000. They're here. And all the departments that were impacted, with the exception of the Agricultural Commissioners, that was the only one that is not available. But all of these agencies were able to help us to come out with a balanced budget. In addition to that, I would say that compared to the last year, we're in a much better shape. And I know it was a hard decision to make last year to do what we have to do to balance the budget, but now we can see the difference this year. I am not saying, though, that we don't need additional staffing. We do need additional staffing. The departments are very thin, working with the minimum staffing that they have. They're thin in their expenditures as well. They have done a tremendous work trying to keep the boat afloat with the funding that we have. So I just want to acknowledge all the departments that were able to keep their budget in place. So I want to also mention the following. So this is what we're having a little bit difficulty, which is the reserves. So you pass a resolution adopting a 15% operational contingency, which is about $10 million. However, taking a set aside the library project and the San Juan Highway that we haven't paid, but I had to project it in there. So you have a shortfall of $4 million in the general 15%. Now, if you go to the emergency contingency, the percentage is calculated based on the expenditures that we have. So we have about $5 million, we have $5 million, but as of June 2025, so we have an excess over of $1.4 million. So together, we have a shortfall of $3.3 million, but we were able to identify, and we confirmed this with the auditor, about $1.975 million that was set aside for a project in 2018 that it never moved. So technically, you have a shortfall of $1.4 million. And the reason I mention this is because I want you to be conscious about we're not meeting what you approved in the last approval of the budget, the approval of the adopted budget. You approved a 15% and a 5%. If you were, we want to make sure that we show you these projections. When we finish the budget, fiscal budget somewhere in August, and we had the real numbers, we would know exactly how everything is going to fall because every deficit will impact the general fund. So we're just hoping that there will be not bigger major issues and that we can keep the reserves the way that they are. But right now, we're not meeting what you approved in the last fiscal budget percentages. Just want you to make you aware of that. So the budget includes 8 additional positions under the general fund. As mentioned before, the assessor, we have a different way that we're going to manage the request that he made. He has available some grant funding, so we might be able to hire a limited term person, but it's not there here yet. So we eliminated that position, and now you have 8 FTCs, full-time employees coming from mostly of the planning department where they have a shortfall. At one point last year, this fiscal year, we went down to 2 planners. And so now we have 3 planners, but we still need assistance because they're falling behind the projects. So these are the positions that we have projected already in the budget that you have a balanced projected budget. The 9 positions that are being requested under the non-general fund are mostly for behavioral health because they have to comply with other requirements. And so with state requirements as well as HSA with 2 additional positions, and 1 probably works in the CSA. And the reason we have the CSA is because we have a number of CSAs they need an additional assistant, and we just, right now, we don't have anyone working in the department. So that includes an additional staff member. We were asked for these items about the 3 different agencies, but before I go over these projections, I just want to make you aware that any direction that you provide us today that is related to the general fund will impact the reserve. So I want to be cautious about approving additional items that will impact the general fund reserve because we're not meeting the reserve yet. And I want you to make you aware of that. I brought the numbers that I was requested, and I don't really want to go over the numbers unless you feel that you want to go over the numbers and impact the general fund. But I will not recommend you to impact the general fund for now. which I believe, based on the presentation that the Sheriff's Department made this morning, any changes in between the department are more feasible because we're not impacting the general fund. The Sheriff's Department is mostly general fund. So I will be cautious of making this determination until you actually have a final budget, the completion of the fiscal year somewhere in August, before you make any decisions that impacts the general fund. Because any of those changes that are over here will impact the general fund. So we have all those, the information about the 3 law enforcement offices, sheriff, probation, and corrections, for bonuses from longevity and for incentives to bring additional staff members. And for the sheriffs, we have also the night shift differential as well. But like I said, all this, I brought it to you as the request from the board, but I'm actually, and I will be responsible for making this recommendation to you, but it's my job as a CEO to recommend you not to make any decisions regarding these items for now that will impact if it's gonna impact the general fund reserves, because we don't have any more room to any more changes. We only have capital projects. I think I presented this last presentation, and it was only like $2 million that we already have into the general fund reserves, as well as the projects. So I want to also discuss with you what the Sheriff Department mentioned a few minutes ago, and I'm bringing this. We just created this spreadsheets just for your information. The staff worked overnight to make this presentation. And so by freezing, and I want to use very carefully the words, freezing, not deleting the positions at the Sheriff's Department. They have 11 vacancies right now. If it was to go and freeze some 5 deputy positions and 1 lieutenant position, we're talking about $1 million. And this was calculated by the HR department. So I'm relying on the numbers that it was provided with. For medical and dental and vision, this is how much. We have about 14 deputies positions and 4 sergeants that falls into the sheriffs and deputies. And for correctionals, we have about 18 individuals. So what I did the numbers, and average, each one of those individuals are getting retained, and it varies, getting retained $339 a paycheck every 2 weeks. And I use average, but in reality, some individuals will have $500 because they have a family with a number of children. So it varies individually. So one single individual may get only $250 or $300. So we did an average, and this is the total amount that I was provided this morning with the savings if we were to provide this benefit on a temporary basis or on a long-term basis, however you want to do it. But my recommendation, based on the proposal of the sheriffs, this is what I was able to come out. So you're talking about $1 million. If it was to fund those individuals with this medical services, it'll be about $318,000. In addition to that, in the bottom spreadsheet for longevity purposes, you will have, only for the Sheriff Department, you're talking about $74,000 and $18,000 for correctionals for longevity, if you were to provide the longevity for individuals that have previous work experience in other counties or in other cities as well. So that's about $90,000 more or less, $95,000. Moving along, we have also a 10% base salary only for one-time retention bonuses. It'll be just the Sheriff Department about $322,000. So when you think about all those benefits, so add $300,000, $318,000, $95,000, that makes us like almost $800,000. So we're able to do that if that's the board decisions to make today. And I want to make sure that we all have this understanding. This is in reaction to an emergency, the urgent matter of keeping patrolling on the streets. And so the other item that I have is the night shift for those individuals that work at night. That's more or less the calculation that we have. So if you were to accept the proposal from the sheriff, it can be contained by freezing, and again, I'm using the word very carefully, freezing those 5 positions until we see the end of the fiscal year. And number 2, to see if we have additional revenues coming from Measure D. So I just want you to make you aware that you will have to make a resolution as an urgent matter, and we'll have to come back to the unions to address those issues that the sheriff is presenting. So with that, I will also request, because it is my understanding, and I might be wrong, so I want county council to correct me if I'm wrong, the board is the ultimate decision about whether or not to change your policy in OPEB if you deem necessary to add additional funding to the sheriff's department or to any other agency. But just want to warn you that making those commitments today will have an effect eventually in the long term. So I want you to have a full understanding of what you could decide today is going to make an impact. Today, we're not asking to do a final approval of the budget because we were not able to roll from OpenGov to the website all the positions with line items because there's a glitch in the system that the staff is addressing, so we'll be able to do it this week. So we're expecting to come back Tuesday with a roll-up of all the departments and details for each one of them, but we have a balanced budget this year, which is much better than last year. And so we didn't have a one-time source funding anymore. We actually using the revenue that we have projected to come to the county. So with that, I would like to open for any questions you might have regarding the budget and
Thank you.
any questions.
Thank you. Let's go to public comment first on everything that we've heard, and then we'll come back to the board.
If you'd like to make a comment in chambers, please provide a speaker card on Zoom. Please press *9 or the raised hand icon. And in chambers, I have Seth Goodman.
Good morning, Board of Supervisors. My name's Seth Goodman. I live in Sunnyside Estates, which is located right near Southside Road and Hospital Road. This is in reference to Sunnyside Park, which KB Homes did promise all of the homeowners there when we were buying that there'd be a park. There's a big space for the park that currently just sits completely vacant. It's awkward. There's nothing but weeds and billions of ground squirrels that have actually burrowed under my foundation already, causing damage. Fighting them all the time, eating my fruit and everything. That's a small issue, but the big issue is we basically now have a ground squirrel haven and a highway for homeless people driving their cars through our parks, over our sidewalks, around our kids, driving slowly, staring at them while they're playing in our front yards. It's just a huge safety concern for us. And we're also just, we were promised this, one by KB Homes. Somehow they got around it. I know Mrs. Curl, thank you for what you said. I'm really encouraged by your support of us in this project and realizing, what a strain it is on our community. There's 4 developments that have been there. One has been there for 25 years. They were promised a park 25 years ago. They still don't have it. So that's discouraging to us. We just feel like we kind of get pushed aside over there or forgot about. And we just really, need your guys' support to get this thing pushed over the top for that park for our communities. There's really nothing close by we can walk to that's a park or ride a bike safely on roads. There are not really any bike lanes, so we just don't have anything for our kids to play on. They're growing up. Every year goes by, they're a little older, and we don't really have a place for our community to congregate and play in a nice park. So, and then when we were encouraged by that fence being built finally, and then shortly after there's a fire, which is a regular occurrence. The homeless people start fires back there all the time. Fire department had to come in, cut the gate down, or no gate, cut the fence down. Now there's a hole big enough to drive through it again. So the homeless people are now using it as a highway again to drive their cars through our neighborhood, over our sidewalks, again, creating safety concerns. So we just really hope that this park is a priority. As far as I know, it's the only development I've seen that just has a big barren piece of land with with just awkward spacing and just, barren wasteland. That does cause problems in multiple ways. So again, I am encouraged. Thank you, Mrs. Kuro, for realizing. And I just hope we can all work together to push this project over the edge. As far as the money looks, to me, it looks like that would be one of the easier ones to accomplish because it's the least expensive. So I hope maybe we can get creative with funding. Who knows, maybe a little of that Verizon tower money could go towards that to push it over. So, I just don't want to miss anything here. Oh, time's up, I guess. But anyway, I think I got most of them. The CFD taxes that we've been paying to maintain a park.
I'm sorry, we
there's
got to
no
be
park.
fair to everyone. You got to cut you
Okay.
at time.
Well, thank you for your time, guys. Maybe that CFD tax money that was saved can go towards that. So.
Thanks.
Next in chambers, Cristina Cardenas.
Morning, Chair and Board of Supervisors. My name is Christina Cardenas. I'm president of SAU Local 521. I want to start by saying that SAU 521 strongly supports our public safety personnel and feel they deserve competitive wages. We support Sheriff Taylor's creative proposal that he stated earlier today and hope other departments are given the same opportunity to propose their own creative solutions for their department needs. With that said, achieving equity for one department should not come at the expense of others. San Benito County departments have already absorbed deep cuts this past year, with some experiencing 30 to 50% reduction in staffing. Further reductions to already strained departments jeopardize the essential infrastructure of our community, and pitting essential services against one another negatively impacts our residents. We urge the board to refrain from further department cuts. Instead, we encourage the board to work collaboratively and creatively with each department for comprehensive solutions that support all county workers and help sustain operations of the community we serve. Thank you.
Next, Denise Quintana.
Good morning, Board. My name is Denise Quintana, and I am here today with SEIU as the Chief Union Steward and Vice President of our local chapter. We know you have to make some very tough choices regarding the budget, and we respect how difficult that is. As you make your decisions, we just want to remind you of the county staff who keep our community running. Over the past few years, our workers have been through a lot. We have faced layoffs and relocations. Today, we are working with fewer people, but facing much higher demands. Despite these challenges, we are still out here every day doing the vital work. We clean the streets, pave the roads, issue birth certificates, serve the neighbors, and in my department, collect support for children. We are an important part of this community. We respectfully ask that you keep our hard work and our sacrifices in mind as you make your final decisions. Thank you for your time and consideration.
Next in chambers, Tammy Avalos.
Good morning, good morning. Tammy Aviles with the Friends of the San Benito County Free Library, and I wanted to speak about what's on the spreadsheet that wasn't really brought up when you went through the budget. So I don't know if it's appropriate to talk about the line item. Okay. So on this page of the general fund snapshot, it says canceling the reserves for the library renovation.
She can't cut off.
Oh, should I? Oh, I'm sorry. Okay, all right. So, obviously I'm here to support and continue the attention to the library expansion project, and want to make sure that it moves forward and that the match is still kept with the county between the library impact fees and the portion that has to come from the county directly. So thank you.
And that concludes public comment.
Thank you.
I want to apologize. I'm just It's a terminology. So what we're doing is canceling on the one side, but actually, when you go back to the presentation, I just want to reaffirm that that was one of our priorities. The only project that is being on the general fund. So let me go back to this slide to show you what we have it. So in the general fund, you see right next to plan use of the fiscal year 2026-2027 library project is there. What we did, because you approved it in the last fiscal year, we canceled it from the last year, but we're bringing it into the budget this year. So it's there. It has never been removed. Just want to give you that assurance that when you go back to the other projects, let me show you something on the projects that we have over here. You see, library expansion remote general fund on the top is the only project that is being funded by the general fund. We kept that in the budget. We didn't remove it, but we had to cancel from the last fiscal year to this fiscal year. That's the reason why.
Thank you. So then at this point, questions from the board?
Yeah,
No, I don't believe there's any more public comment, no.
Mr. Chair, I guess I'm pleased and satisfied with where we're at. I guess mainly just getting direction on what specific, if there isn't any disagreement, what specific motion we would need to continue this, to give direction to come back. Sounds like Tuesday. So that's the first thing, just mainly just, maybe county council can help with the motion that it applies to this, as long as there aren't any other changes. The only thing I was gonna ask is, if it's possible to take a look at, when you look at the sheriff's numbers, and he's got everything laid out, if, with regard to the benefit of transferring years of service from other agencies, it was brought up that if we included, when I spoke with the representatives at the sheriff's, if we included existing employees, can we at least just get a number of what that additional, if that could fit into the dollar amount that was provided, that we have available?
I have it already. Let me show you right now.
Alfredo, put the presentation, please.
Okay. So this is, we did it in about 10% one-time retention bonuses over here, but we had the longevity on the top. And this is for, based on current employees. So when you're talking about the sheriffs, all the items that he requested today with the 5 positions, I guess he did his number and then figure out if I have frozen 5 deputies and 1 lieutenant, I will be able to afford this many of items. And that's what we did, kind of like putting it together to be able to provide those services between the budget that he already has approved and the general fund. This would not impact the reserves or the general fund. I want to make sure that.
No, but my question is more specific about the years of service, that
This is the years of service.
The proposal was to allow new recruits. So if somebody comes over and they have 5 years of service at Gilroy or wherever, that we could use that in the calculation for benefits. But I was told that if you included existing employees, it wouldn't be a drastic increase. And I don't know what that number is, obviously, but if you included existing employees, would get that, people that came over recently, basically.
So I'm going to give you an example why it's so difficult to determine an amount of money for individuals that are coming our way. If the sheriff hires an individual that only had been 5 years in another city, and we recognize those 5 years, that's a 5% increase automatically.
Right.
But if he gets a lateral sheriff or a police officer with 20 years of experience, that's a 20% increase. So those are different numbers depending on depending number one and the position, whether it's a sheriff or a sergeant, it'll change. We can get the worst case scenario.
No, I'm just thinking of existing employees.
The existing employees, we have it over here. This is the current employees that we have for longevity. We have that one already.
But would they be eligible, let's just say theoretically, there's Sergeant X or Deputy A, and they've been here now for a year. When they came here, they didn't get the service credit. Is there the ability to include them in the service credit
That will be the decision that the board has to make because we already calculated the numbers that you have
And
here.
again, I think what we're doing is very bold. I think these are really positive steps in the right direction. I think the deputies and the sheriff are very happy with where we're at. It was just a question that was posed to me. I don't know if it's at all possible to have a number and to see how drastic of an increase that may be by Tuesday, just to at least
So I
have the number and see
again,
if it fits in perhaps to the.
I have the number. I
okay.
show you the number. So if somebody can download again, okay. You see this area where it's increase and longevity? Okay. Okay, just to increase. Okay, so if you see it in this slideshow, and these are just numbers that we created. Increase in longevity for current employees based on prior years of services. Whatever they submitted when they were hired at the county, the staff went individually by each one of them to determine the amount of money that they will be increased. So they make the determination from the deputies and sergeants to be $32,000, for the lieutenants and captains, $42,000, and for the corrections, $18,000.
But it's included basically is what you're getting.
Yes, that's what I'm
Okay.
getting
All right,
into
that's
it.
all.
So this $74,000 and $18,000 is about $95,000. So when you think about this, 318 plus $90,000, that's more or less 400 and something. And then when you include the additional 10% one retention, which is about 25,000, so it's a total of 322 for the sheriffs only. And I'm just talking about the sheriffs because he is the one that came with the proposal. And the night shift as well is included. So the savings that he is proposing between his department without impacting the general fund and without impacting the reserves, the $1 million that he's gonna save by freezing those positions on a temporary basis will be able to cover those expenses.
Okay, great. Thank you.
Okay.
Mr. Chair.
Yes.
Just to piggyback on that, because I want to make sure that we're really clear. When we talk about longevity for existing employees, is it going retro? So are you going back to when they were hired that they would have gotten that longevity and then the step increases that they've received or the COLAs that they've received on top of that? Because it changes the amount. I want to make sure that we're really clear on what we're authorizing in the budget so that we aren't giving a false, it's not like you're getting longevity today. We're actually talking about you were a former employee in Santa Clara County. You worked 5 years in Santa Clara County. You've been with us a year. We would go back to your original hire and calculate your longevity and then all of your increases since that date. And am I wrong?
HR, did
No. So
I just want to make sure we're really clear about what we're
Come up and
authorizing.
clarify
yes.
what we're
So
talking
what we calculated was the following. We go back to the previous years. We acknowledge the number of years and it's calculated in today's salary. Today's salaries includes all the COLAs and everything. So it's based on today's salary and it's moving forward from today and on.
I just want to
Not
make sure that that's
retroactive.
clear. We're not going retro. Okay? Just making sure that we're all on the same page.
Yeah, Ms. Collier is correct. So we calculated moving forward just the rate in which they would be in.
I just don't want any false
Got it.
impressions of what we're doing.
Yep.
So as mentioned before, it is attainable with the freezing of 5 deputies. And I wanted to ensure you again that this will not impact the general fund and will not impact the reserves. We're not touching them because we're already balanced. And if you were to not approve this one and approve it under the general fund, I will have to go back to the departments and do additional cut-ups. I don't want to do that, to be honest. I will not recommend you to do that. I'm not making the decisions, I'm just giving you a heads up. In regards to the comments about deleting additional positions, actually this year we adding 8 positions to the budget. So some of them are from the ACIU group as well. So we're not deleting any positions. We're not doing any layoffs right now as it is. Thank you.
Yes.
So I saw that the assessor I believe originally had a position. I mean, he's listed there, the assessor, but then it's empty on
Yes.
that box. Did he eliminate that position? He no longer needs
So
that position, or what's going on with that?
he originally requested that position for long term. So what we decided, because he came on board with us and said, let's negotiate. So he has some grant fundings that we can do a limited term for now until we see the end of the fiscal year. So he will be able to afford this individual for a while at a limited term until we find out if we have additional revenue of the end of the fiscal year. My concern is that we don't have an end of fiscal year. We don't know the real numbers. This is all based on projections. And so he came to the table and negotiated with us that he will hire that person for a year or 2 years with the funding that he has available and grant funding.
So so he's still getting the position, he's just not paying for it with the general fund. But then shouldn't it have been listed under new positions requested non-general fund?
Because we had to come back to the board to make that request officially to the board. We're not adding the position yet until we come back to the Board of Supervisors with a request to increase that position with general fund. We don't have it. Unless you wanted to approve it today, when next Tuesday, a non-general fund position funded by funding with grant funding.
Well, it just makes sense to me that we bring it back next week and include it in, I mean, you've got public works CSAs and, building grounds. You've got some other positions in there that typically would fall under general fund, but they're using grant fund or impacts or whatever.
Fund. Those are general fund.
No, it's listed under non-general fund.
No, you're talking about the other position. Hold on one second.
What am
So
I
I have
missing here?
two lists. One is
I'm
general
looking at
fund.
the one that lists all of HHSA and behavioral health.
Those are non-general fund.
Right, and at the very top of that list,
Yes.
Resource Management Agency, Public Works,
So-
CSAs, Building and Grounds Maintenance Worker.
So we're gonna add the assessors to that list.
Okay.
Which is too late to add it.
Okay, I just want to make sure, I'd rather get kind of this done and for the assessor to know that that position is included in this rather than us having to bring it back in a month or 3 months from now or whatever it is. Like if that's what our intent is, let's try to get that included in this for next week.
The only difference is that this non-general fund positions are long-term. His position will be limited term, and we'll make that reference in the list.
Okay, all right, great, thank you.
Mr. Chair.
Yes.
So in our last meeting, I thought we also, is this the end of our presentation, just to make sure I'm not done here?
It's just an interim presentation, and as I mentioned before, we couldn't roll off the budget line items because there's a glitch in the system.
I'm letting that go.
Okay.
Okay, I'm letting that go. But we did talk about Measure D, and we talked about projections. Is that going to be coming to us on the 30th?
Yes.
Okay.
Because we just run out of time to make the Measure D and all the parts all together.
And the reason I'm saying that is because even though this interim emergency crisis proposal for the sheriff's deputies is being proposed, once we go down this path, it will be very hard to ever stop going down this path. And we have other bargaining units, and we have to start looking at how we're going to be able to find and strike some balance. Now, I'm not saying every bargaining unit's going to be exactly the same. There's always, I have never agreed that everybody should get the exact same thing at the exact same time, because there are challenges and there are, things that you just need to address. Livability in this community is a major problem that we know we have. So I just want to make sure that that Measure D conversation has not stopped.
Yes, but again, it will be a projection. I want to make sure that we all understand it's a projected. I think I got an email last night from, he's not here, he left. Oh no, he's there. From Abraham about one project that I might be able to move forward. So there's hope there for the Measure D. Okay.
Thank you.
But we do need to get that program going ASAP, because the longer we wait, the less money, we're not collecting money now.
No, so I just need your direction, and today's county council may be able to help us so that we can proceed with the proposal from the sheriffs and bring it back as a formalized item.
Yeah,
But
so what
today
would
you
be
can
a-
make that approval.
And I don't need to make the motion, but what can we, is everyone done? Can we do a
Ready to go.
motion? What would be the motion, county council? What would be the appropriate motion to take into account everything that CEO Colio Warren has stated, and to bring it back Tuesday for final approval.
Mr. Chair, members of the Board of Supervisors. Yes, I believe that the appropriate motion would be to direct the CEO to consider all of the comments and the direction that the board has provided today, to come back on June 30th with the proposed interim budget for board approval.
Thank you.
And that would necessarily include the proposal which the sheriff has presented today, and as has been described by the CEO based on the numbers that have been generated as to the specific costs for each one of the elements of the sheriff's proposal.
Okay.
My only addition to that would be making sure that we have a complete road list to be able to select what our priorities are, making sure that that's part of the direction that was given by the board.
And I would add in, if I made the auto trigger to the vacancies in the sheriff's office, that as a policy that we're going to formally, we would be agreeing to bring those back if we do fill those positions.
Yes, that's correct.
Okay.
Those were clear directions that have been provided by the board, and we will ensure that all direction will be included in the presentation you will receive on June 30th with a proposed budget for approval. That is an interim budget.
Just want to make the motion as stated then?
Go ahead.
I move to approve per staff's recommendation, per staff's summary, but also with comments from Supervisor Kosmicki and myself. And that's it. That's the motion.
Is there a second? Okay, may we have a roll call vote, please?
Supervisor Zanger?
Yes.
Supervisor Kosmicki?
Yes.
Supervisor Sotelo?
Yes.
Supervisor Curl?
Yes.
4-0 vote, motion passes. Thank you.
Thank you. Thank you, everyone. That's it for today.